Today we have to discuss about the topic is syphilis in bacterial infection. Syphilis, it is caused by Treponema pallidum. It is characterized by episode of active disease interrupted by period of latency, and it is gram positive. It is divided into two. One is acquired syphilis and another one is congenital syphilis. The acquired syphilis, it is transmitted through sexual contact or cuts or break or contaminated needles or direct contact. It is three stages. One is primary, other is secondary, another one is tertiary. In primary stage, there is a canker developed at the site of inoculation within 1 to 3 weeks, commonly on penis in male, uvula or cervix in female. Also found in other areas. There is a elevated ulcerated nodule, which means elevated ulcerated nodule with local induration. Is called canker. It is brownish crusted appearance and regional lymphadenitis will be seen. This is the regional lymphadenitis. Regional lymphadenitis also seen. In intraoral area, it is ulcerated and covered by a grayish white and may be painful. It is demonstrated by dark field examination of microscope, and enlarged lymph nodes will be seen. Increased inflammatory infiltrate. In canker, the ulcerated area having increased inflammatory infiltrate and plasma cell numerous. This canker heals within 3 weeks. In secondary syphilis, it is about after 6 weeks of primary syphilis. Diffused eruption of skin and mucous membrane. It is multiple. Macules or papules which are painless. In oral lesion, it is called as mucous patch. It is multiple, painless and grayish white and ulcerated. Tongue, gingiva or buccal mucosa are the common site. It is surrounded by the erythematous zone. The mucous patches is highly infectious, hence vast number of microorganisms will be seen and spontaneous remission. This Louis maligna, this widespread form. It is nothing but fever, headache, muscle pain, necrotic ulceration. This Louis maligna is characterized by fever, headache, muscle pain and necrotic ulceration. After second stage, free from lesion and symptoms, it is moved into latent phase. It is latent stage and lasts for 1 to 30 years. In tertiary syphilis, it is a late phase, chiefly involve central nervous system and cardiovascular system. It is the hypersensitivity, type 4 hypersensitivity reaction between host and treponemas. It is called as gumma. The gamma is frequently in skin and mucous membrane and liver, testis and bone also involved. There is a focal granulomatous inflammatory process with central necrosis is seen in gamma. Focal granulomatous inflammatory process with central necrosis in gamma. It is from millimeter to centimeter in size. In intraoral gamma, it is tongue and palate are the common site. It is a painless ulcer. This palate area causes perforation and sloughing of necrotic mass. This is the necrotic mass. This necrotic mass gets sloughing off by vigorous antibiotic therapy. In syphilitic glossitis, fissure is due to atrophy of the tongue, and fibrosis of tongue hyperkeratosis leads to fissure. This is the important characteristic of syphilis. It undergoes carcinomatous transformation. In congenital syphilis, it is transmitted to offspring only by infected mother, totally preventable by antibiotic treatment. This congenital syphilis have frontal bossing, short maxilla, high palatal arch, and saddle nose, and Hutchison are also seen. In diagnosis, Weisserman test and a Hinton test will be done, and false positive in non-syphilitic because of the presence of Treponema microdentium and Treponema macrodentium. The treatment is penicillin is the drug of choice. If the patient is allergic to penicillin, erythromycin or tetracycline is suggested. Thank you.